Hi, my name is Greg Fell, I'm Director of Public Health. This is a situation report on epidemiology of today, the 29th of March. So, since last week, case rates have started to track up, particularly in the over 18s and the early working age adults. That was to be expected, I think. It's happened across the country and it's to be expected. Importantly, case rates are going down in the over 60s, and that's the group that are most likely to be seriously ill. R has tipped up a little bit. Currently for Yorkshire, it's between 0.8 and 1, so that's somewhere between slowly shrinking and static. But positivity's increased ever so slightly, and again to be expected given the government are easing us out of lockdown. It's worth looking at what's happened in other countries. Israel is the closest to the UK, a very, very well vaccinated population. As Israel opened up, case rates increased, then stabilised and started to go down. And there's just some signs of the stabilisation in Sheffield. Too early to call, but just some signs. So a bit of flattening, and I'd encourage I think we need to hold our nerve for the next week or two. We're certainly not doing any of the wrong things. And the things that we are doing are probably the right things. Important to look at rate versus impact. So I've talked about the 7-day rate. The impact is a different matter. So the critical metrics, hospitalisation, the rate, 7-day rate in the over 60s and positivity are all pretty good, actually. Certainly a lot better than they were 2-3 weeks ago, and a lot better than they were two months ago. The reason why it's tipped up in Sheffield and Yorkshire is that the Kent variant, or the B117 variant, didn't really take hold before the lockdown we're in now and coming out of now, but it is taking hold now that we're coming out of lockdown. So key worries for the future: spread in the non-vaccinated. There's still significant numbers of people who aren't vaccinated, and we will continue to keep the strategy that we've got for the time being. So on the vaccine programme continues pretty rapidly in Sheffield. So far, over 220,000 people have received their first dose, and 18,000 have received their second dose. Think about what an astounding achievement that is. It's truly amazing. I've heard concerns about side effects with the vaccines. Like all medicines cause side effects, vaccines are no different. Most of the side effects are mild and short term, and not everyone gets them. Research that was published fairly recently by the COVID symptom study, the Zoe app and King's College London, on Pfizer and the Oxford AstraZeneca vaccine demonstrates really clearly that side effects occur with both. That study found that about 1 in 3 reported whole body after effects after the first dose of AstraZeneca, and about 1 in 10 after the first dose of Pfizer. People tended to feel worse after the second dose of the Pfizer vaccine than the first. And research showed that more people are more likely to have side effects if they've had COVID in the past. So if you experience side effects after your first dose, you do still need to have the second dose. That really, really matters, because both doses offer the most protection. As I say, most side effects are mild. I have a slightly sore arm, but mostly the side effects are the sore arm, feeling tired, headache, feeling achy, or nausea, feeling sick. Obviously, the flip side of the side effect coin is the really, really positive effect that you're less likely to get COVID, and you're significantly less likely to be very seriously ill from COVID. So remember, everyone aged over 50 is now eligible for the vaccine, alongside those people with a health condition and health and social care workers. They're being invited. If you missed your invite, it's not too late. If you're in one of those groups, please look out for the call or text from your practice or from the NHS, or call your GP practice or 119 to book an appointment. Vaccines save lives. Please get booked in today. So on the roadmap, from today, the stay-at-home advice changes. Still stay local, continue to minimise travel, but you can meet outdoors, either in a group of 6 people from any number of households, or in a group of any size with people from 2 households, and each household can include existing support bubbles. Organised outdoor sports can restart with any number of people. Outdoor sports venues and facilities will be able to reopen. Childcare and supervised activities will be allowed outdoors for all children. formally organised parents and child groups will be able to take place outdoors for up to 15 attendees, and children under the age of 5 will not be counted in that number. So we cautiously ease out of lockdown. It's important to remember the basics: keep your distance, wash hands frequently, wipe down any surfaces and those that are frequently touched, particularly door handles and light switches. We will continue with broadly the same strategy, so that the key elements of our strategy as a city: testing, particularly if you have symptoms, get tested early, being on top of outbreaks when they occur, vaccination, contact tracing, prevention, and supporting those that are asked to isolate. And those won't change through the course of the pandemic.